How are you?
Hey, Rob. I'm good. How are you?
Did you get the copy of the latest Patient Safety Times?
I haven't.
I got one for you.
Thanks for sharing.
Yeah. This is a kind of a strange Starbucks, eh?
It is a very strange
These
Starbucks.
chairs. Who are all these people? I don't know. Anyway, I was looking at this while I was waiting for you to come. Do you know that there are more than 35,000 Canadians who die every year because of preventable harm in the healthcare system?
Yeah, Rob, unfortunately I am, because I'm one of those people who got
That's
harmed.
like 100 a day. That's like 4 people every hour. Like, what's going on?
I don't know. I do know that there's a lot of us out there who are trying to work together to help the system, though.
Yeah, well, I guess we need to get a lot of things done. I can't understand why we haven't been able to figure it out. In 1999, there was a big report in the US called "To Err is Human." We haven't really managed to move the needle on patient safety much in the past 20 years.
Mm-hmm. So what do you think the problem is? Why can't we get this situation under control?
Yeah, that's a good question. I think we have to get together on this.
Mm-hmm. Yeah, I'm going to be really blunt here with you, Rob. I think that the system is more concerned with protecting itself than with protecting patients.
Yeah, I like that. You're talking about the elephant in the room. Of course, we're in Canada, so we're talking about the dead moose on the table in case... Oh, there's somebody from Newfoundland. Okay, so yeah. We need to get that out. We need to start talking about these things. What's wrong? What's preventing us from moving ahead? Yeah. I think we need to launch a challenge for everyone. That includes all of you who cares about this public health crisis. And the challenge is to get together. Let's start with the Minister of Health and the insurance companies, the CMPA and the Healthcare Protection Plan, and the colleges of physicians and surgeons, and the College of Hospitals.
Mm-hmm.
Well, I don't know.
I feel like you're missing somebody.
Oh.
What about the patients?
Oh. Uh-oh. Yeah, I sort of, yeah. Patients. Okay, yeah, they should be sitting at the table too. Let's all get together around that table.
I guess you haven't heard the patient mantra. Nothing about me without me.
Say that again so I can really get it.
Nothing about me without me.
Okay, yeah, that makes sense. I'm really sorry about that. I just kind of goofed there.
It's okay, I'll forgive you this time.
Yeah. So you know what? I think the challenge when all these people are sitting around is we gotta get legal liability off the table. We need a moratorium on lawsuits in healthcare. And we need to do that so that when we really start to learn from the system. Right now, there's too many impediments.
So are you suggesting a kind of no-fault system? I hear that works in a lot of countries. It certainly is a kinder approach.
Well, we got to shift from suing people and putting up barriers to learning so we can come to a better understanding and actually change something.
I can't even imagine all of the learnings we could capture if we could talk openly after a patient safety incident. No more of this shame and blame game. Both the patient and the provider could heal.
Yeah, you could say that again. I'm pretty sure that most docs, nurses, pharmacists, everybody would be on board for that. You know what? We have to start treating patients with respect, giving them honest answers to their legitimate questions. Stop the stonewalling. And we have to be allowed to do that. So there's going to be some changes in legislation that's required.
I like the sound of this. I wish I had that kind of option when I had experienced an adverse event.
Yeah, that's
so,
true.
This all sounds great, Rob, but how are we going to make it happen? Yeah. Why will the system start providing open and transparent answers? And will hospitals and doctors and nurses be comfortable talking openly to us?
Yeah, if we can get everybody to agree to this moratorium, get rid of the lawsuits and litigation, we'll start learning, and we'll be able to set up a true restorative just culture approach. So much more effective than the traditional punitive approach.
I think a restorative justice approach to harm in healthcare is very appropriate. The question will inevitably be, how are we going to pay for this?
Yeah, so we're going to make some changes to Section 51 of the Evidence Act. We need to change the way complaints are handled by the licensing bodies. And so healthcare providers are no longer afraid of investigations. We can learn.
Mm-hmm. Didn't you tell me that there's more than like $5 billion to deal with medical liability and only like 40 or 50 million to deal with patient safety? Why can't we use some of that money?
That is really messed up, but those are the real figures. And I don't know, if we were to look at it for BC, that would be, maybe if we can agree to a pilot project for the province, about $450 million would be available. And the government wouldn't have to continue paying all of the doctors' medical legal fees.
I'm listening.
Yeah, patient safety investigators, though, so that we can learn, they're gonna start getting trained in the new techniques, the nonlinear methods to analyze and understand, and so that we come up with robust understanding of what's happening.
I just hate to say this, but when something sounds too good to be true, you haven't said anything about apologies or direct sharing between parties and providers.
Yeah, we talked about the restorative just culture approach. We're going to train people in that, and that's going to make those conversations easier. Yeah. Who are we forgetting in this story anyway? The College of Hospitals.
Except there is no College of
no,
Hospitals.
come on. Are you
That's
kidding?
right. But we need to invite the universities and the colleges.
Yeah, that's true. That's true. I guess so. I don't know what.
So what are we waiting for?
Yeah, I don't know. Maybe these folks can tell us. There's a lot of people for a Starbucks here. I don't know. I don't get it, but yeah, we need to sort that out. It's a big problem. 4 people an hour are dying. That's not good. Yeah, so I don't know. What do you think?
Well.